Could you please state your name and your birth date?
Why are you asking me this?
Well, I just want to make sure that you are who I think you are.
Well, that's a good idea. Ron Jones, December 15th, 1955.
Okay, and this is really just a safety check just to make sure I've got the correct patient. And I do. My name is Sue, and I'm one of the nurses here.
Pleased to meet you.
Thank you. I'm going to just be asking you a few questions, a bit of a history, and I may be taking notes. It's just about that. So, what brings you to our clinic today?
I've got a cough, but I've had a cough for a while now. This past week, it seems to be getting worse, and I'm coughing stuff up.
Some stuff. Can you tell me about the stuff you're coughing up or the sputum you're bringing up?
It seems yellowish, but maybe sometimes greenish looking.
And how are you feeling generally overall?
Well, I feel a bit tired all the time.
Okay. Are you having any fever or chills?
No.
No? Are you on any medications?
Yes, I had been taking some antibiotics.
Okay.
They didn't seem to do much, so I stopped taking them.
Okay, well, I'm just going to give you a little information. Antibiotics work best when you take the whole dosage. If you start and stop them, the bacteria might not be killed, and then it can come back and be a little bit stronger. And it's one of the medications where you should take the whole dose with, and it's usually only 7 or 10 days at a time, but you should take all of it.
Oh, I didn't know that. Thanks for the information.
Oh, no problem. Back to your cough. Are you a smoker?
Yes, I smoked for a long time.
Okay, can you tell me how many years of smoking that is?
2 packs a day, just about.
And for how long?
35 years now.
Have you ever thought about quitting?
Yes, but it's really hard now.
Yeah, I've heard that it is. I haven't experienced that, but I have some information on a smoker's helpline. Would you like to see that?
Sure. What have I got to lose?
Okay, well, I'll give that to you before you leave. I know you've told me you don't have a fever, but I would like to take your blood pressure, pulse, your vital signs just before the doctor comes to see you. So is that okay with you?
Sure.
And I'd like to listen to your chest as well.
Okay.
Okay, good. Well, I'll get that ready. First, I'm going to take your temperature. Okay. So just stick this under your tongue. I'll hold it because it's kind of heavy. Should be beeping in a minute. Great. Okay. I'm just going to put this in the garbage. And I'm going to take your blood pressure. Now I need to climb up and grab this. You've had your blood pressure done before?
Yes.
Okay. So I need your arm. Just going to pull your... And I'm going to have to get my stethoscope. And have you had your blood pressure done before?
Yes.
Okay, do you know what it is?
No.
No. Now I'll take your blood pressure. Thank you. Now, lastly, I'll check your pulse. Excuse me, I'm doing much. Okay, good, thanks. Now, your temperature is 37, your pulse is 88, your blood pressure is 150/84, and your respirations were 16. Now I need to listen to your chest sounds. It's the last part. I'll do that. Can you take a deep breath in and breathe out? And again. One more time. And again. Okay, great. I hear wheezing in the lower part of your lungs. Do you feel that when you're breathing?
I think so, yeah.
Yeah. Okay, so I've got your vital signs and I've listened to your chest with some wheezing. The doctor's going to be coming in next. I'm just going to give her the results of what I've just done, and she'll come and visit with you, and then I'll see you after that.
Okay.
Okay,
Thanks.
good. All right. Okay, I'm back. The doctor has heard the very same things that I heard. She's told me she's going to give you some inhalers to use at home. Have you ever used an inhaler before?
Yes, I have, but they've even shown me how to use a spacer.
Oh, that's great. The spacer is supposed to help get the drug down deep into your lungs where it can work where it's supposed to. And have you ever had 2 inhalers before?
No, why?
Well, they're 2 different drugs, and you need to know which one you should take first for the best medication usage for your body. So one of the inhalers opens the tubes in your respiratory lungs a little bit bigger, so it should be taken first. And then when you take the second drug, it goes a little bit deeper. It can go, the passageway is bigger, so it can go down into your lungs better, and it's an anti-inflammatory, so that drug is best to go second to get down to where the inflammation in your lungs is happening, causing you some problems.
I had no idea that it would matter which one I took first.
Yeah, you know what? Many people don't know that, so that's why I explained it, because if you understand, it makes so much more sense in how you should take them.
I learned a lot today, both about antibiotics and now inhalers.
Yeah, good. I'm glad I could help with the information and anything.
So what's next?
Well, I think you can go home with your prescriptions. The doctor wants you to come back in about 10 days and take another course of antibiotics, but the whole dose. And 10 days later from now, you can make an appointment. So you make the appointment today on your way out, and you'll be seen again then.
Okay, thanks for everything. I'll see you next week. Oh yeah, can I get that helpline number?
Oh, right, I did get it when I was out of the room, so here it is. It's for you, the helpline number, and you give them a call and see what happens.
Okay, thanks.
Okay, great.
Bye.
Bye-bye.
Mr. Murray, I'm Dr. Corbett.
Nice to meet you.
Yes, sir. Nice to meet you. Yeah, first time we've met.
Yes.
Yeah.
Yes.
So I understand you made an appointment for an examination.
Yes, correct.
And we're going to a complete physical examination. I understand.
Yes.
And I'm going to ask you about why you came into that. But will you mind if I take a few notes just in case?
No, that'd be fine.
In case you got lots to tell me. Don't want to miss too much.
That'll be
okay?
fine.
Good. Good. So you made an appointment for an exam. When's the last time you had a physical examination?
Probably 2 years ago.
2 years ago.
Yeah.
Okay. Well, tell me why you made this one.
Well, I had these chronic headaches going on that I've had for about 3 months now, and they're just not getting any better, and I want to see if there's something we can do about it.
So when you say chronic, you're referring to the fact that they've just been steady for 3 months, or they've been longer than that?
Well, it started 3 months ago, and they were like every other day or so, and now I'm having them every day. And
So you have no days when you don't have a headache?
I have a headache every day.
But at the beginning, it didn't seem to be quite as noticeable then for you, huh?
No.
Describe the headaches. Where are they, and what do they feel like?
They start at the back of my head here, and they kind of come up around my temples, I guess you call it, and into the front of my head. Sometimes they're throbbing. You know, other times they're not quite as bad.
Yeah. So it's both sides of your... And it starts in the back and comes up the front.
Correct.
Do you have a headache all the time, or does it just come in episodes?
Well, I have a headache all the time until I take something. I take Advil and Tylenol that seem to help it, and that eases it up.
Is it ever gone? Or is it always something there?
There's always something there. I always know it's there. It's just the intensity of it.
I see. Can you tell me a little bit more about what you notice? For example, when is it the worst? At night, in the morning, or doesn't it make a difference?
Well, it doesn't make a whole lot of difference. When I don't get enough sleep, it's really bad. If I move my head in a certain way, or if I strain or stretch my head in a certain way, it seems
Like
to be
what
worse.
way? Can you show me that?
If I go like, to the back, or if I'm bending over, just any exaggerated moves.
Any exaggerated move makes it
seems to make it
Yeah,
worse. And if I don't take the Advil and the Tylenol, it seems to be worse.
Makes it worse too. I see. So this 3 months ago it started. It's both sides. It's in the back, and you can make it worse if you either extend or
Yes.
lean forward for too long. Is
Yes,
that the idea?
just I call them exaggerated head movements.
What happens when you're lying down? Does that ease it or make it worse?
I think that eases it some.
It does.
Especially if I can get some sleep.
I see.
It seems to ease it up some.
So the act of lying down and sleeping doesn't make it worse.
No, I would
Makes
say.
it better, maybe.
Yes.
I see. Does it change based on if you're eating, for example?
No.
Does eating make it worse or better?
No, eating doesn't seem to
So having a full stomach
exasperate it.
doesn't seem
No.
to bother it at all either, huh? How about if you're concentrating, is when you're driving or reading?
No, it doesn't make it worse, except when it's really bad, I have a hard time focusing.
Okay, yeah,
know.
that's helpful.
Yeah.
Does it ever seem to be more one side than the other?
No, it always seems to come up and be just kind of like meets in the middle.
Meets in the middle, huh? Starts in the back,
Yeah.
goes around, meets in the middle.
Like a tight band.
Yep. And the part that's always there is what? In the back or all over?
I would say in the back.
In the back
Yeah.
of it too.
It always starts in the back. I got rear-ended in a car accident, and I can remember my neck got jerked, and I had a sore neck for a couple days, and then the headache started shortly after that.
So that accident started this thing off.
That's when it all
So
started.
you had no headache before this?
No, I had no
That's helpful.
previous headaches.
So
before.
tell me about that. How fast were you? Were they going?
Well, it wasn't very fast. It was in a parking lot, and I was backing out, and somebody else was backing out the other way, and we met. And I just remember that jerk of my head,
Gotcha.
and having a stiff, sore neck. for
So
a couple
both
days.
cars couldn't have been going more than start up.
Yeah.
Okay.
5 miles an hour or something like that.
Did you strike your head when that happened?
No.
That you recall?
Not that I recall.
Yeah.
I just remember it kind of being, I guess they call it whiplash.
Did you get out of the car right away?
No, I sat there for a few minutes, and then I got out of the
Did
car.
you?
It startled me.
Did you?
Yeah.
Then you said the headache started after that. How long after the actual accident did the headache start?
3 or 4 days after.
So it wasn't right away. There was a
Wasn't
little
right
bit of a
away,
warm up.
yeah.
There was a kind of an interval in there where you
Yes.
felt fine. I see. Did you think that you had hurt yourself?
I didn't think I really had hurt myself. I didn't, I felt startled and, just kind of shaken, but I didn't feel like I was really injured.
But didn't. Okay.
I didn't go to the hospital or anything like that.
Yeah. Have you? And you said you take some things for it. What actually helps it? What do you?
Tylenol and Advil. I take, I guess it's,
How much do you take?
I take a lot. I take 16 Advils, 4 tabs, 4 times a day,
Wow.
and I take,
Self-prescribed?
yes, 2 Tylenols 4 times a day. So I'm taking
8 Tylenol and 16.
24 pills a day.
Advil. Wow. I take it you warmed up to that. That you weren't using.
Right. I started out
I
with less
see.
and it wasn't working, so I just
I
kept
see.
adding to it, and it does give me some relief.
It's a lot of medication.
It doesn't, yeah, it seems like too much. That's one
Does
of
that-
the reasons I came to see you.
Good for you. Yeah. Does that mean it just keeps getting worse?
The headaches just kept getting worse, and the severity of them, yes.
Yeah. That's a lot of medication.
Yes.
Before you had this accident, did you use those medications much, if at all?
No, very seldom.
No, never had to take that kind of thing with
No.
any regularity at all?
No.
Okay. I need to know, too, what else do you experience? Anything else? Does this make your body feel different or painful or uncomfortable in any way?
It makes you feel stressed. I feel stressful with it. I can't sleep well. It's uncomfortable.
Yeah.
It's just kind of a nagging thing that's there all the time.
Does it bother your shoulders, your arms? You feel anything down here?
No, No.
Strength,
Pretty good.
tingling?
No. No. Not really.
How about just being able to use your arms in normal motion?
Yeah,
That's not disturbed at all?
No, that's fine.
I see,
That's
I
fine.
see. Wow, so you had an accident, took a couple of days for this thing to get to you, 3 or 4 days, but then it started bothering you and persist, and now almost has this stubborn worsening. Is that what I'm...
Daily.
Daily. And what kind of work do you do?
I work in a car dealership. I'm a service manager.
Oh, yeah.
Yeah.
So has this had an impact on your ability to just do your normal stuff?
Well, again, it has in that it's uncomfortable. I feel stressed because of it. I'm able to do my job. I like my job.
So you can do your work? Have you missed any days from work?
I think I missed 2 days in the beginning, but I've been at work since then. I'm able to go to work, but I make sure I have my Advil and Tylenol with me. Other than that, I'm working.
You sound like a
okay.
great employee to me. To work through this kind of thing is pretty difficult.
Well, I like what I do. I work on vintage cars on the side.
I see. Yeah.
Yeah. So I
Okay.
try to make it.
I have a sense of what you're telling me. What's your diagnosis?
I don't know if I did something to my spinal column back there. I don't know what you guys call it, but something happened when I got hit, is what I think. A jerk did something. Other than that, I don't know what it is.
But you're fairly sure there was a couple of days in there where it wasn't obvious to you that there was anything wrong?
Other than it just being sore.
Okay.
It was sore and stiff. But the headaches didn't start, like I said, until about 3 or 4 days later.
So there was some discomfort
Yes.
right
there
away.
was.
But you would call it more a soreness or stiffness
Yes.
than an actual headache like you're having
Right,
now. Okay.
right.
Gotcha, yeah. I need to know a few more things
Okay.
about the effect of this on you. How's your sleeping? Do you sleep okay?
And I don't sleep well at all.
Why not?
The headache, the discomfort, it's hard to get to sleep. I sometimes can get to sleep and then the headache wakes me up. So my sleep patterns have been totally
So that's
disrupted.
So how much sleep are you getting at night compared to what you'd like to get?
Well, I used to sleep the night through, which was probably at least 8 hours. And I'm probably up 3 and 4 times a night now.
Wow. And how long is that? I would call it a sleep deficit. How long has that been going on?
Well, this happened 3 months ago, probably 2.5 months now. Because it wasn't as bad in the beginning, but they did just get worse.
Wow. Did you consult with anybody else, or you been just toughing this out on your own?
I've just been
Pretty
toughing
much.
it out on my own and
Yeah.
trying to, hoping it will go away, but it's just getting worse.
But you have been able to do your work, think, use your hands?
Yes.
Nothing disturbed in that way, huh?
No.
Gotcha. Anybody else know? Does your wife, are you married?
Yes, I am.
You've been talking to your wife about this?
She certainly knows.